think we'll start, Dr. Mads, with you just giving an overview on the situation that's currently taking place in Gaza.
Yeah, thank you for having me, Mari. And we're all pretty devastated this morning when they picked up again on the bombing. And so far today they've killed 100 Palestinians. We know from the previous numbers that approximately 70% of them will be women and children, the majority children. And then you can multiply by 4 to get the number of injured, so maybe 100 killed and 400 injured, which are, a new load on the medical system, which is, as we all know, already diminished by the senseless Israeli attacks on healthcare in Gaza. On the 8th of October, Gaza started out with 34 out of 36 hospitals operative. They were a little bit not fully operative because of the 16 years of siege, but 34. And through those first 3 weeks, the Israelis have squeezed, bombed, strangulated the hospitals so that they now have 3 fully operative hospitals, and they are all in the south. So it's a massive attack on what people always feel as the last sanctuary, and that is to come to hospital, where you're cared for. I call it the temple of compassion and humanity in any society, because that's where you go and you feel protected, because the international law and human decency, you don't attack a hospital, you don't carry a gun there, you don't bomb it. Not so with Israelis. So they have systematically attacked the hospital system in Gaza, which was not a bad hospital system. I mean, Shifa was type of university hospital, very high level, the new Shifa Medical Complex block with lots of new equipment, collected money, fundraising from all over the world to give the Palestinians the best possible healthcare. Now it's all destroyed by the Israeli army in probably the largest ever attack on civilian healthcare in history. I cannot recall any such directed, targeted attack on healthcare where people are actually, according to international law, they are secured to have, protection and healthcare. Mm-hmm. And not only that, they've also destroyed the better part of the primary healthcare system, the clinics, primary healthcare clinics. And the good people of Gaza, the doctors and the nurses in those remaining hospitals, they're working around the clock and also in the primary healthcare. But despite that, they cannot sort of stem the tide of injured, wounded, and of people who have just ordinary diseases. Yeah. They have diabetes, they don't have insulin because they don't have the cold chain that you need to preserve the insulin. Mm-hmm. They don't have the type of insulin they're used to, so now they're using mixed insulin. Then you have to change the dosage regime. You need to know these tables. You have all the kids with diarrhea. You have 170,000 people with infectious diseases. You have 1,100 who are getting yellow because they have got hepatitis. So you have a massive increase in the public health needs, in addition to all these wounded, in addition to those 20,000 plus who have been wounded through this last 5-6 weeks, 8 weeks, who need surgery, follow-up surgery, lots of open fractures, lots of burns in kids, and the hospital capacity has been so diminished. They started at almost 5,000 beds in Gaza, and now they're down to maybe 1,400, 1,300. And that cannot accommodate 2.5 million, 2.2 million people. So you had already a massive disaster in the healthcare sector, and then they restart the bombing. They attack people, good people, refugees, anybody, kill. They attack the UNRWA schools, totally forbidden, prohibited, and they are not letting sufficient aid into Gaza. I was at the meeting here in Amman yesterday. The big question is, how can we get more help into Gaza?